We do, and we've got Allan Valenzuela joining us with Alliance Physical Therapy, and we've got Charlotte Reynolds, a patient of Allan's, on the Gun Barrel location. Okay, this doesn't surprise me, Allan. Charlotte, tell everybody how far you drive for this particular treatment that we'll talk about here in just a few minutes.
Not sure about the miles, but it's approximately 4 hours.
4 hours. Tell everybody where you're from.
Corinth, Mississippi.
From Mississippi. You've got a lot of clients that patients.
We have clients that come from all over the place. We do a lot of unique treatments, and it's for that rare person that doesn't respond to traditional physical therapy.
So, all right, Allan, tell us about, now I remember about a couple of years ago.
We did this on your back because this is great for chronic back pain.
Okay.
It's awesome for plantar fasciitis. In Charlotte's case, we treat her at the Gun Barrel location because she's got calcification and tendonitis. And Charlotte, tell them real quick how much medication you were on before you started treatments and the type of pain you were in.
I was in a lot of pain. It felt like a 10 on the level. I was taking medication every day, and then I started searching the web for treatments for tendonitis to be something natural when I found the Shockwave therapy. So I came to Chattanooga to start the therapy, and it's really helped my pain level.
So tell me how this works.
So a quick and easy way, this is a shock wave. So it's sending energy through the tissues and breaking up anything that's scarred down, adhered, moving fluid. So if you think about throwing a pebble in the water and you get that ripple effect, it's like throwing a pebble, right, one behind the other, and getting that ripple effect through the tissue. And you're trying to stimulate a inflammation response, your healing process your body does, bringing healing cells into the area, moving waste products out of the area into the lymphatic system, and that allows for healing, decreased pain, and increased functional movement.
Okay, Charlotte, real quickly, you said your pain level was at a 10, so obviously you felt awful with your shoulder. After how many treatments?
I've had 9 treatments.
And how do you feel now?
A lot better. Pain level is way down.
Yeah. How many treatments does it take?
So these are 5-minute treatments, 5 to 8 minutes top.
5 minutes. Okay.
And so somebody might have a functional improvement and decrease significant pain in one treatment.
Wow.
So it's hard to say, but we generally want to treat somebody once to 3 times a week. Charlotte's driving 8 hours a day to come and go. So she's only coming once a week, and in 9 treatments, she has made significant improvements. She's only taken pain medication once or twice a week now, as compared to every day.
Okay. All right. So real quickly, tell us what it looks like when you sit down with a patient.
This is it, pretty much, and it has different size heads. Okay. So the larger the surface, the bigger the head. With Charlotte, we'd use a smaller head or tip, as you can see here, and you can adjust how fast it hits you and how strongly it hits you. Okay. So it's going to sound like this.
Oh yeah, I remember that sound.
Just going to move it around the area where there's the least amount of pain to break up anything that's adhered, and then they'll eventually move into the area where the problem is actually at. So it takes a few sessions to get there. You don't want to be too aggressive because you could run a patient off, because it's not like it's a massage.
Yeah, sure. Yeah. Well, okay, after a session, how do you feel like with the shock therapy? I mean, is it hot? Is it are you kind of sore a little bit?
In the beginning, it was kind of sore and discomfort, but after a few days, it started feeling better.
Okay, all right, makes sense. Totally makes sense. Okay, when a patient comes to see you, just walks in the door, it says, "Can you look at my shoulder?" What's the percentage of you going, you know what, you qualify for the Shockwave treatment?
Yeah, that would be hard to answer.
Okay, because there's all kinds of elements with shoulders.
What's nice about this is a diagnostic tool too. So if you used it for diagnosis of pain and dysfunction and did an initial treatment with it, and they had a recovery, you'd see increased movement, decreased pain, then you would know this is a great choice. So we do tend to use it on a lot of patients in the evaluation process.
Alliance Physical Therapy, 9 locations, by the way, very convenient for you. 877-703-0011, nopainpt.com. Charlotte, thank you very much. Be careful going back to Mississippi. Allan, always good seeing you.
Appreciate you having me on.